Hello, this is Katie Folken, Amber Blog, and Jennifer Johnson with the University of Sioux Falls presenting for our public health class on the health needs of pregnant women living in poverty. Our introduction and purpose is to provide awareness about and address determinants and health concerns faced by the vulnerable group of pregnant women living in poverty and its effects on babies born to this group. Vulnerable populations are those that are at higher risk for certain medical, physical, or social problems due to specific determinants of health. Some of these health disparities include issues such as homelessness, job loss, economic hardship, food insecurity, domestic violence, incarceration of the pregnant woman or her partner, lack of emotional or practical support, chemical dependence, and more. This population is considered vulnerable for poverty's effects on not only the mother, but also on the unborn fetus. Poverty is defined as the state or condition of having little or no money, goods, or means of support, conditions of being poor. Determinants of health include lack of access to health care, such as in rural areas, as well as transportation issues, inability to pay for care, and lack of education. Major health needs of this population include the ability of providers to act as a trusted support during pregnancy, to refer women to local agencies that can provide some of their needs, which may include transportation, and to educate them on the importance of prenatal care and other health needs. By reviewing literature and key agency information, as well as discussion with key informants in the community, health needs and possible interventions have been recognized and established for this population. Poverty during pregnancy has been proven to cause low birth weight babies, low intrauterine growth, and neonatal or infant death. Poverty during pregnancy has also been linked to cognitive learning disabilities and poor school performance for the children born of maternal poverty. Our nursing diagnosis is at risk for ineffective prenatal health management among pregnant women living in poverty related to lack of access to basic needs and basic prenatal care. Pregnancy can provide an opportunity to identify existing health risks in women and to prevent future health problems for women and their children. Nursing assessment and referrals can help expose risk factors for maternal poverty. This can help prevent lifelong health issues for the baby. Future health problems can include inadequate nutrition and unhealthy weight. It is also known that access to prenatal care can decrease maternal and infant mortality rates. Prenatal health of the mother can determine a child's health for life and set a course of healthcare disparities in health outcomes. Lack of prenatal care is also a barrier to women living in poverty. They may lack access to care in rural locations, transportation to clinics, or resources to pay for those visits. Prenatal nutrition can affect the health of the woman and the child for years to come. Lack of education regarding state-run programs such as WIC and Medicaid also continue to put the maternal poor at higher risk for low birth weight babies and other health factors. Lower birth weights that result from poverty can have lasting consequences across the lifespan. Prevention of these issues can be one step towards a healthier life for the child. Please take note of the graph on the lower right-hand side of the poster that depicts the barriers to receiving prenatal care, and take note of the top or the largest barrier is a financial concern or lack of money, or therefore poverty. Within the greater Sioux Empire area, there are multiple agencies that exist to help close the gap of poor pregnant women and adequate health care. A few of those national and local resources are listed on your poster. The national resources that are available are Medicaid and SNAP, the WIC program, United Way through the Sioux Empire, Volunteers of America, the New Start program, Look Up and Hope program, and then we have local resources available as well. Falls Community Health, the Destiny Clinic, Bishop Dudley House, Alpha Center, the Good Shepherd Ministry and Counseling Center, Union Gospel Mission, St. Francis House, the Banquet, food banks, and food giveaways. Healthcare providers may be a crucial source of on-site or referral support services to buffer the health-damaging effects of hardship on women and their children. Nurses should function as advocates and supporters of healthcare policy that provides assistance to pregnant women living in poverty. One of the recommendations from Healthy People 2020 is to decrease the overall number of infant deaths. You'll see on our poster some of these best practices. Under primary interventions, posting posters in public places, homeless shelters, and libraries that contain contacts for support services for prenatal education and cares. An option for secondary intervention would be screenings in public health offices, homeless centers, physician offices to determine the economic status and finding specific resources if they are considered poverty-stricken. An option for a tertiary intervention would be using public services like that of Volunteers of America to continually educate pregnant women, assist and educate women on how to break the poverty cycle, such as by educating on the processes needed to gain an education, find an affordable housing situation, as well as other continued support from providers. Advocating for poor pregnant women and referring them to available agencies, recognizing the barriers experienced by pregnant women that prevent early or any prenatal care, and determining ways to change this. In conclusion, through research it is found that poor pregnant women need adequate resources in order to help ensure the outcome of a healthy baby. Needs include education regarding healthy living, nutrition, and social skills. It is found that women experiencing poverty during pregnancy can lead to low birth weight babies, low intrauterine growth, and neonatal or infant death. Poverty during pregnancy has also been linked to cognitive learning disabilities and poor school performance for the children born of maternal poverty. South Dakota, especially in the Sioux Falls area, has a wide variety of programs and services available for low-income people. It is the responsibility of healthcare workers to be able to help determine the needs of the poor, pregnant women, and then refer them to the agency that best suits their needs. There are a wide variety of resources, including those that will address food, housing, insurance, and childcare. This also includes services for the abused and homeless. Advocating for, educating, and referring pregnant women to available resources specific to each woman is very important in order for pregnancy in the vulnerable population to end with a healthy baby. Babies do not have a choice in their circumstance. They do not have a choice of being born preterm or low birth weight. It should be a primary goal of public health nursing, according to Healthy People 2020, to grow these healthy babies born to poor women. Given education and resources from public health nursing, women have a chance to receive help for nutrition, prenatal care, and healthy lifestyle choices to give their babies every chance to be born healthy and to be given a good start at life.